Oh man, I was being silly. Someone just gave me this at 182 and I said, oh, okay. Then I bet on it. Then here I started to say to myself, oh shit, this was a bad idea. I shouldn't have did that. But now I'm going to watch these guys and see what happens. I'll do that for a little swing. And then another little swing I'm thinking, I think I'm going to sell my out of this half of it. Actually, I'm going to wait because they are rising, but they don't have any news. So because I don't see their news, I'm going to hold on. And then this would be a good example about HIMS. I talk about HIMS, swing trading a lot. HIMS down because I have to look this up. Okay, the FDA trading lower following FDA's ban on compounded weight loss, despite obviously their strong financial gains. Now, this could be complicated for HIMS. Oh, man. Now, HIMS has many more things besides just their GL1Ps. They also hired that menopause doctor, because menopause therapies are going to be important, and hormone therapies, because I have a theory. There's a lot of people that do need hormone things for various things. Maybe they are a gender person, and all of these doctors' offices for hormones are going to be closing. So HIMS could be an option for people that need hormone therapies. Anyways, this deadline set to reshape access to some of the most in-demand weight loss drugs starting today. God damn it. They are going to prohibit most pharmacies and providers from producing or distributing compound versions of GLP-1 medications. All right, these would be the Ozempic, Wegovy knockoffs in a way. The move follows months of mounting pressure on regulators to tighten control. Demand has soared in recent years. Okay, so remember that HIMS made their partnership with Nova and Eli Lilly. So they were preparing for this because also Trump's going to tell these places that they have to sell this stuff for less. He issued this executive order saying they needed to do the equalizing. So his new word, it's going to be equalizing. All right?
He's the white Latifah.
Yes. What we're doing is equalizing. There's a new word that I came up with, which is probably the best word. We're going to equalize where we're all going to pay the same. We're going to pay what Europe's going to pay. I think that, so that is definitely going to be good for HIMS. But anyways, so, and the other part, if they're going to ban the compound drugs, there's going to be rules. Unless they are made for a specific individual with a valid prescription and medical need that cannot be met with a commercially available product. HIMS specifically helps patients develop their individual weight loss plans, which may sometimes require these individual and valid prescriptions. So I think HIMS could benefit from that. Also recall, HIMS donated $1 million to Trump's inauguration fund, which I think bodes well for HIMS. So did both the CEOs, the co-founders. So that's $3 million total towards HIMS that we know about. And drug compounding is allowed in limited cases when medications must be tailored to meet a patient's unique clinical needs, such as when a patient is allergic to an ingredient. However, producing compounded drugs in bulk and for general use, especially when FDA approved, are available in sufficient supply is not permitted. Who's to say what's allergic to something? People are allergic to things all the time. I don't think this is bad for HIMS, but definitely it'll create buying opportunity for HIMS. And I think things will go down more. I kind of do. This downtrend, as you can see from HIMS's charts, is really nothing for HIMS. So we'll see what happens with this. But I think people are overreacting, but that is typically what people always do with HIMS. They're not compound drugs. Those are the ones that are regular. They're their regular brands. HIMS makes like spin-off ones with like different APIs, active pharmaceutical ingredients. They're still allowed, Ozempic and Wegovy, still allowed the same way they're being used for the weight loss. He's just saying that these compounder companies, specifically HIMS, well, he doesn't say which ones. There's probably other ones doing it.
They're all doing it.
But it's not about...
Dr. G is doing it too.
No, yours is not.
No. Dr. G is doing it. If I lived...
Oh, yeah, you... Oh, then... Oh.
I could get it, yeah.
So little clinics also do this. That's probably who he's trying to cut down on. I didn't know that.
Yeah.
But another one that's a good swing, OKLO. And I'm trying to debate. See, OKLO could go higher too. OKLO is like HIMS in the way that they are nice swings. So I would also say I might be waiting for some more OKLO news to bring them up. to the 40 range. I think they're about to do it. And then SMR. I'm just holding them now. They're not as so they're doing things too. What is the nuclear news? Wait, do we have any nuclear news?
Go Godzilla and Kong.
Ooh, just Iran. We don't want to know about that one. Keep that one out of here. But a 2 billion-year-old nuclear reactor exists and it wasn't built by us. Oh, shut up, India. It doesn't really say anything, but I think those nice swings and the OCGN. I don't know what I want to do with the OCGN, but that one could be another interesting one. Past 24 hours. Ooh, no. Just as stupid. U.S. nuclear intensifies lobbying a bid to save tax credits. That's technically GIVO, but that could also affect OKLO as they are considered clean. But Chris Wright, all over X, he's very big on nuclear.